A few weeks back, I reacted to Happy Tree Friends medical scenes and got bombarded with requests to do a part 2. That's why today, we're wasting no time and breaking down and learning about all the injuries and craziness that this show has to offer. But before we get into it, if you are new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in. Oh geez. Oh, I hate when that happens. What the? Oh! What? If that actually does happen, right, the major blood vessel that's coming down is your aorta in the abdomen. And if that just gets opened up, you can't stop it from bleeding. You're just gonna bleed out in a couple of seconds and you're gonna die. Then, of course, you have your spinal cord that's severed. The bottom half of your body is gone. No, wait a minute. Nice, that's so disturbing. Holy cow, okay, this is disturbing as you could get. It looks like a piece of ham. Could this be survivable? I guess if you're able to stop the bleeding, you're able to survive a little bit longer, obviously. But then the question is, what organs are injured and is it compatible with life? I'm assuming he's blind too, so he doesn't always, I don't understand. Is he blind or driving blind? Oh. How many times has somebody done that? Just leaking out. Now you got a trail of blood. You have a trail of fire. Oh my gosh, come on. It doesn't work that way. Impaled into the abdomen, come on. There would be a lot more fire extinguisher injuries than you've ever heard of, but typically you don't, and it's spraying a powdered mist that's a fire retardant to get it to stop. Oh, and the car explodes. That's messed up. You see the explosion, it takes apart the abdomen, and now you have intestines that are just rolling around. And so the intestines look like this tube, but it's attached by all this mesentery. So it actually is still in a big formed ball when it's in your abdomen. It kind of comes out like a little bit of a fan versus just these strings. Oh. Oh. That's just mean. What the heck is that? You don't do it with a full cup of hot coffee. Now the animal has either a first, second, third, or even 4th degree burn. So we don't know what degree of burn. So 1st degree burn, it's like a sunburn. It's just a superficial layer, it turns red. 2nd degree burn, there's 2 different types. There's a superficial versus deep, but that's when you get the blistering. Then you have 3rd degree burn, which basically burns through the capillaries and the nerves, which will then end up meaning a skin graft. And then if it's 4th degree burn, it's going all the way down into the subcutaneous tissue, fat, muscles. Pretty bad situation. Oh. Whoa! Oh, nice. Oh man, bleeding out of the ears. So you can have a rupture of your TM or your tympanic membrane, or what we call the eardrum. You might not have good hearing as well after. Sometimes you can have a perforated eardrum and it's fine and it heals up well on its own. Other times you need a tympanoplasty where you actually get a new eardrum from yourself actually. You can use a piece of fascia and then put it right on there. Oh my gosh. Oh, come on. When you're using the otoscope, it shines light into the ear canal, the external auditory ear canal. So that way you can see the tympanic membrane and see if the canal is swollen. That's pretty much all you're gonna see. You wanna make sure that there's something called the cone of light, which is a reflection of light off the tympanic membrane to make sure it's intact. Oh, tuning forks, nice. All right, I get here. When I was in medical school and in training, we used tuning forks. We don't typically use them too much anymore, but the point of a tuning fork is to hear if there's bone conduction loss versus neurosensory loss, having to do with you tap it, you hear the noise, and then you can actually put it on the bone to see if you're having conduction. Oh, you can hear better. Nice. It has just a larger diameter so you can take in more of the noise, so you can pretty much try to amplify it. Now you have hearing aids that can amplify your noise, and then even then, some people who have no hearing, you can get cochlear implants. If you've ever seen somebody with like an electronic device attached to their head, and they can help them hear. I love this candy squirrel. Oh. 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 Oh man, I thought it was a broken tooth, but it is a fractured jaw. That's crazy. Typically, the only times I see a fractured jaw is trauma from like getting punched in the face or car accidents. And usually you're broken in two places because the energy goes in one place and it needs to go out the other. And sometimes, of course, you get dental injuries as well. Or sometimes we get avulsions where the tooth is gone. Remember, if your tooth falls out and it's an adult tooth, two things that you can do is either put it in a glass of milk or just put it back in your own mouth. And typically we can just shove it right back in there, and then we'll do a dental splint and then get you off to the dentist to make sure that it stays more permanently. Ooh. Oh yeah. Pliers. Woo. Yep. So why the heck do we wire a mouth shut? It's like a splint or a cast for a broken bone. You want it to set in one spot and not be able to move it in different directions. And then they actually give you a set of pliers so you can actually break through it if you get sick or you need to vomit, because you won't be able to get the vomit out. Oh, people hate it. Yeah, look at trying to use a screwdriver to open. Oh my gosh. This squirrel has a horrible sugar addiction. So sugar is a type of carbohydrate, right? Simple carbohydrate. And our bodies crave it. So if you have it, you're never satisfied. You always want more and you want more and you want more. Oh, oh no! A tongue laceration. Actually, amputation. Holy cow. If you have an injury to your tongue where it's bleeding, it bleeds so much, profusely, hard to control the bleeding, and it's just like all coming out. Yep. It's like a helmet. Oh my gosh. With a lock. That's horrible. I've never seen one of these. We have this thing called the halo, which gets screwed into the skull for somebody who has a cervical fracture. I've never seen this device for a jaw fracture. Oh. What the? It happens. Oh my gosh. What the? Your eye has multiple muscles and then it's connected in the back by your optic nerve. So it's probably the optic nerve that we see hanging out here. But the skin is gone. You don't see any of that. The nose is gone. Holy cow. What is going on? The intestines are very stretchy, right? So the intestines are actually made of muscle and muscle stretches. So it wouldn't rip typically. It could at some point, it's going to rip with enough force. It also potentially wouldn't necessarily strangle you per se because it's so stretchy. But if you have enough force, it's going to do that. This is ridiculous and scary. Oh my gosh. Hiding inside the sleeping bag and now threw it in the fire. This is a horrible scene. Normally the steering wheel would not do that. It would typically actually could bend. A lot of times people will get spidering of the windshield if their head hits the windshield. What the? Bottom half of his body falls off, rips out. That doesn't happen. But the anatomy looks so good. What we see hanging at the end of the clip is the stomach. That's the shape of the stomach. And it's most likely attached to the esophagus still. The esophagus attaches to your stomach. And then from the stomach, it attaches to your small intestine. Basically, the first part of your small intestines is your duodenum. Okay, we all know this is not realistic. But could you actually survive your duodenum being separated from your stomach? Yes, if you have a surgeon that can put it back together. Depending on the accident, a trauma surgeon would need to see versus a general surgeon versus both being in there. Typically a trauma surgeon is also a general surgeon as well. So this is my second iteration of Happy Tree Friends. Now it is a quite disturbing cartoon, but from an anatomy standpoint and from a doctor standpoint, it's actually quite entertaining to watch as long as you understand what you're getting yourself into. Do you have a favorite TV show or movie that features medical situations that you want me to break down further and explain? Let me know which show or episodes in the comments below. Or if I missed any Happy Tree Friends scenes that I should check out for another video. As always, make sure you subscribe if you want to see more fun videos like this one, and check out my Doctor Reaction series right here to catch up on all the reviews of your favorite TV shows. Thank you so much for watching, and stay healthy, my friends.